I'm Paul with Dose Health, and we help seniors take their medications on time. So the problem we're addressing is medication non-adherence. It's a really big problem that doesn't get addressed very often. CVS has called it a hidden epidemic because it accounts for 125,000 lost lives. And that's actually 3 times the number of deaths compared to car accidents per year in the United States. It also accounts for $300 billion in avoidable healthcare costs. So it's a huge problem that isn't necessarily addressed at the level it needs to be. We're building on a software and hardware platform that is centered around a smart pill dispenser. And so I handed one out. I should get one to the audience too. But it's really easy to use that the first thing it's going to do is automatically dispense the medications. So it will rotate into the right location, and then it will send a series of sound and then flashing lights. And all the senior has to do is flip the device in their hand, and that motion is picked up. So we track everything about the device, and then over Wi-Fi or cellular, we bring it up to our software application. We call that Dose Anywhere. And with that, we want to do 2 big things. Number 1 is involve caregivers. So they can get phone, text, or email notifications about the device and be involved in the care and get that peace of mind. The second piece is to generate real-time adherence data for the healthcare system. Right now, that doesn't really exist in any meaningful capacity. And we think it's going to be a huge impact in the healthcare system right now. As far as the total available market, no matter how you cut it, it's very large. Right now, in any 30-day period, there's 31 million Americans taking 5 or more prescription medications. We're targeting the 2.2 million population that are covered under the Home and Community-Based Services waiver. And what that is, it's a covered program by the federal government. It's a Medicaid program that basically covers the cost to keep people living independently in their home rather than in a nursing home. And so we're covered under Minnesota for that right now. And our goal is to reach 10% of that population. And taking 10% of that is 220,000 individuals. Right now, we get about $40 per month. We charge a monthly fee for the platform. And we expect someone to be on it for 24 to 32 months. So at the low end, that would be $960 and would amount for $211 million in revenue. But probably more importantly, up to $2 billion in healthcare costs in just this population. So our competition right now is primarily these 3 devices in the waiver market. And the big things that separate us from the competition is number 1, the size. So this is actually to scale. And it's pretty profound going to someone's home and really seeing what a big difference it is. The next thing is that it's very easy to use and set up. And then finally, the reliability is huge. We only have 2 moving parts. And that makes a big difference when you're talking about something as sensitive as medications. We launched last summer. And so we've logged over 10,000 dispenses and are seeing an adherence rate of 96%. And the industry looks at anything above 80% as great. That's considered adherent. That's frankly a number we really didn't expect to hit this early, and we're really proud of it. We basically have sold out of our first manufacturing run. We're waiting on our next set of units, and we're looking to scale this model. I'd just like to end on a testimonial. This is our longest running person. She's been on the platform for almost a year, and it's a mother taking care of, a daughter taking care of her mother who has dementia. And I just heard that from the nurse this week that without our products, she would be most likely in assisted living. So it meant a big difference for why we're doing this as a company. And here's our team.
So is there a process where somebody has to load the device with the jugs, and who does that?
Yeah, that's a key touch point. The 3 people that are involved is either the client themselves, particularly if they have disability and they have the cognitive capacity to do so. The next one is a home healthcare nurse. That's very often that they'll come every week to fill the device. And then finally, it's a family caregiver. And so you can't tell with the one that's locked, but the compartments are removable. And so we're looking for pharmacy integration where they can fill those as part of that supply chain.
Okay, touch on the IP and how much capital you've raised and how much you think you need.
So we raised, not the previous September, but the September before, about $200,000. And so we've done all this with that. Right now, we've raised a small round to keep the lights on. We run extremely lean. And since we've built out the business model, we're making the decision of what amount to raise and what makes sense. We're kind of adverse to increasing our burn, but there's some strategic partnerships that are coming up in the summer that we're very interested in seeing how it's going to turn out, particularly with statewide contracts.
So you're not sure how much you would
We're
need
not-
the next 12 to 18 months?
We actually are burned with what we've just raised and how we could go 18 months with it. So we're really looking for strategic partnerships to see how we can scale this most effectively and as fast as possible. That was one of the questions. So. Oh, the IP. We are turning our 6 provisionals into whatever utility patents we can get in the next coming months.
What is the data from the device? Where does that go? What's the software that you're using? What does it interface with?
We host our servers on AWS. It's through a Wi-Fi connection that it's sent over. I've designed it all. And so that's just stored in a database that we aggregate all the data there.
And how, so the example you gave of the daughter who got the phone call.
Yes.
So who phones her? The device, your system? How
Our
does she know?
servers do, actually.
Okay.
So the device will send a trigger to our servers, and then that server will make the phone or text.
Okay. Does that include interface with clinicians as well and some of the health, patient's record?
That's our dream in a lot of ways. I left residency for that reason in particular because we really think that this could be a huge benefit when it's integrated in the healthcare system. We wanted an established business model before we move forward. And so those are the kind of conversations we're having right now. Thanks.